Hi, this is Mansa. Welcome to our channel. Now we are in Vrindasri Jubilee Clinic with Dr. Prabhu Kumar Challagari, consultant physician and diabetics. Hi, sir.
Hi.
How are you?
Fantastic.
Now in these corona times, how is your hospital and how are you doing?
We are doing very well. You see, even though there is COVID, we have prepared our patients and many people around us how to face it, how to go ahead boldly without any problem.
Okay.
Courageously, our patients are doing very well.
Okay.
They're all following all the needy things like, masking themselves or using sanitizers or, physical distance. All these kind of things our patients are doing very much. And moreover, we have boosted them with positive energies, given them, the proper advice how to deal the COVID situations and all. We have also given them, the immunity boosters. Basically, as our patients are diabetics and hypertensives, or cardiac issues and many other things involved in their life, we have, from the beginning itself, we have boosted their immunity by giving, the immunity boosters. So most of our patients are what the so-called nowadays, people are running after the vitamin D, vitamin C, vitamin E, and calcium, and then iron supplementation and all these things. But coming to our practice, we are basically from the beginning itself. Once the patient comes to our clinic, we start treating them with all the needy things, even to boost up their immunity also.
Okay.
First thing is we'll boost them with positive energy. Second thing is we also supplement them with the needy medications depending upon their reports. So till now our patients are doing very well, very fantastic, fit, fine, fantastic, and most of our people who are viewing us in televisions also, we have a very positive reports with different kinds of small techniques which we have told our patients.
Okay.
Especially the turmeric with drinking with milk, warm milk, is doing wonders. And some patients, they are doing the vaporization, steam inhalation. Having some hot water with them, using some Vicks in that with turmeric powder, using Vicks or, Amrutanjan or Jendu bomb or any other kind of thing. So they are using in this hot water and then doing the steam inhalation constantly for about 3 to 5 times a day.
Okay.
Most of our patients are doing miracles with all these things. We are getting inundated calls that with these little techniques, most of our patients, they have done this.
Okay.
Drinking, warm water every day, hot water every day, thrice or 4 times a day or 5 times a day, drinking warm water and doing the steam inhalation from past few days.
Okay.
They are doing miracles. They are doing wonders. They are calling me and telling from past few days we are having this problem, but with these positive energies as well as the simple techniques at home remedies, with all these things, most of the patients are doing wonders.
Tell some of the home remedies for us also so that we can use it.
See, the simple thing, what we are doing is in COVID, or if you are suspected COVID, or you are COVID positive also, first thing is don't get into panic attacks.
Okay.
Just get relaxed. There are 3 kinds of patients in this COVID. The very first kind of patients in the COVID are stable patients. See, most of the people, they don't know even they got COVID or not. They will have little feeling in their body, like, some symptoms like, they have some throat irritation or burning eyes or burning body, fever and little kind of things. Simple symptoms will be there.
Okay.
But they should not go into a panic state. If it comes positive or negative, don't worry. These are stable patients. So they come under the stable category. These people need to just take appropriate medication by the advice of a physician or a pulmonologist. Take appropriate medicine. Appropriate medicine generally people have to keep it in mind, under the prescription, under the supervision of doctors only, medicines to be used.
Okay.
Coming to the home remedies, what we do with these people is we ask them to do steam inhalation. Steam inhalation means using hot water with little turmeric in that, little of Jendu balm or Vicks or Amrutanjan, anything. Put little in. Even in 1918 also, Spanish flu, they used Vicks VapoRub.
Yes.
People used Vicks VapoRub those days. It's a big medicine. So same thing we also applied here.
Okay.
Generally, for any cold patients, people used to do it at homes.
Inhalation.
In the steam inhalation.
Yeah.
like this kind of things. This is one important major technique. They can do 3 or 4 times a day. But don't put all these things together. You add Vicks, add Genda Delisma, add Amurtanjan. No, either of these things.
Okay.
Either of things. Don't put all these together and take the decision. No, that is not the right way. So people have to understand really this is the way, one thing which they can do. And then drinking some milk every day with some, pepper or with some turmeric is a good deal.
Okay.
Then also drinking warm water. And take good food, proteinaceous food, good healthy diet, and a strong sleep. If you had a good sleep, go for a good sleep. That's it. So this is the way we are treating the COVID patients as well as non-COVID patients, or who have symptoms, suspects and all. This is one kind of treatment. That's for stable patients. And then coming to the second stage, who needs oxygen?
Okay.
These people, because of the infection in the lungs, the breathing becomes difficult. Even the same techniques, home remedies applies here also, but at the same time we also treat them aggressively in order to stop the infection spreading in the lungs, the viral pneumonitis. So in order to stop this viral pneumonitis, the same home remedies, and we give them aggressive treatment by giving the tablets and all.
Okay.
So that is, we monitor them whether they go into ventilator or not. So first thing they can do, the stable patients, they can stay in home quarantine. Second patient, they need oxygen support.
Yeah.
Rest is a very important thing. They should sleep well, no anxiety, no panic attacks. They have to sleep well.
Okay.
The third phase of patients who are ventilator patients. The ventilator patients need to be admitted in the hospital for sure. From oxygen stage itself, we want them to be, staying in the hospital. We want them to get into admission to the hospital and take the treatment. If it is going into ventilator, they should be closely monitored. Now here, no remedies will work. We have to give them nebulization kind of things.
Yeah.
We will use all those needy things in the nebulization. We give a lot of intravenous injections, IV injections, antibiotics, antiviral drugs. We have a lot of things have come up nowadays. So we use all these antibiotics, antivirals, antifungals, and whatever needed to the patient. According to the patient requirement, we attend him in the hospitals. So this is a hospital-based treatment. From oxygen support itself to ventilator, all these things should be done in the hospital.
Okay.
So home quarantine people, we have a special plan for them who are staying in the home. We have a video consultation for them.
Okay.
We talk to them, give them positive boosting energies. We talk to them and give them appropriate treatment. And keep them, not going into the next stage of life.
Okay.
So this is the way we treat the COVID patients.
Okay. Actually, in these terms, every person should have that positive energy.
Yes. Positive energy will surely make the patient to come out of the problem.
Yeah, very sure.
So what I tell to many of my patients is be positive, be happy, don't get stressed.
Even you are treating COVID patients in your clinic?
Generally, we don't encourage people who are COVID to come to the clinics.
Okay.
We keep them at home.
Home quarantine.
If they're standard, if they have a standard home with a single room to stay,
okay,
we ask them to stay at home itself. Take all the we are telling all the treatment plan. So we will send the treatment plan. We give them medications and all, and we talk to them on video calls, and they come out of the problem easily.
Many people are telling that if they are having some throat issue or some breathing issue, they are staying at home simply and they are taking hot water intake and all. Is it okay to be at home?
That's what. If you are comfortable, if you don't need oxygen, so these patients can stay at home quarantine, take healthy food, do all the home remedies, as well as we give them some immunity boosters and tablets and all this kind of thing. They can stay at home. If they have any doubts or any queries, they can surely call us. They can surely call the doctors. But keeping under the supervision of a doctor is important, so that if something is going wrong, they can be advised in an appropriate way. So to advise in an appropriate way, they have to come into contact.
Okay.
To a doctor or whoever they know, they can come to doctor, or doctors like us who are physicians, who are pulmonologists, they're ready to help them out.
Okay, viewers, this is what doctor says. People who are suffering from COVID or those who are suspected, please don't get into panic. Stay home, stay safe.
Thanks for watching this video. Like and subscribe for more videos.